And good afternoon. Good afternoon once again. I'm Robert George, the host of Bloomberg Opinion Editorial Board Conversations. And it's my distinct honor once again to have my colleague Mary Duenwald here. And we're going to get to talk once again about COVID, COVID pills, mandates, and fun stuff like that. So Mary, the big news today is that Pfizer has appealed to FDA for use of a COVID antiviral pill. And there's been some discussion about this over the last couple of weeks as another game changer in battling this pandemic. Some are saying, well, it's even an alternative. Because of that, we now don't really need vaccine mandates. And you wrote about vaccine mandates recently. Why do you think, why the COVID pill is good in and of itself, but why it shouldn't be seen as an alternative to a vaccine?
The COVID pill is good because it's a way for people who get COVID symptoms. If they notice those symptoms early enough and get tested and are sure they have COVID, they can take these pills. It's a complicated regimen. You take 30 pills over the course of 5 days with the Pfizer regimen. But it can prevent hospitalization. If you take the pills within 3 days of symptoms, according to the clinical trials, it can cut your risk of hospitalization by 89% and eliminate the risk of death. That's what the clinical trial, and so it's a very powerful preventive of serious illness. Once you have serious illness, it doesn't work anymore because what it does is prevent the virus from replicating. Once the illness is bad, that ship has sailed. But the hope is that these pills will be able to treat even breakthrough cases of COVID-19, even though those tests weren't specifically done. And possibly people have speculated that if you started to have a surge of COVID in a community and people knew that they had been exposed to people with COVID-19 and they were, especially if they were not vaccinated, they could take these pills too as an early preventive treatment for
almost in a prophylactic sense.
Yeah, that's been speculated. And, there's so many questions about the pills, both the Pfizer pills and the Merck pills. The clinical trials were fairly narrow, and there are a lot of questions about side effects and exactly how effective they are. It looks as if the Pfizer pill is way more effective than the Merck pill, but the studies were done slightly differently, and so it's not entirely clear. The Pfizer pill was really effective if you took it within 3 days. The Merck pill was less effective, but they were testing taking it within 5 days. So there's a lot of future study that's still going to be needed on these pills, but they have enough to go on to ask for emergency use authorization.
Now, we had pretty strong language in our editorial that supported the Biden administration's push for a vaccine mandate. That these pills, as good as they are and the promise that they hold, they shouldn't be seen as an alternative to the vaccine itself. Let me just put it this way: assuming I'm somebody who doesn't know much about the difference between vaccines and pills and things like that, I've heard that Pfizer, the Pfizer vaccine is supposed to be effective, have like a 94 or 95% effectiveness rate. I think you said that the COVID pill is supposed to be 89% in terms of preventing serious illness and hospitalization and things like that. When I look at those different numbers, if I'm just the average person on the street, why shouldn't I say, okay, well, I'm wary about this vaccine, so if I get sick, I'll just take the pills and I'll see it through.
I mean, people have compared it to preventing a fire and waiting for a fire to happen and putting it out. The vaccines prevent infection and they prevent serious illness. You don't have to be there right within 3 days of getting symptoms. You don't have to do everything perfectly and take 30 pills over 5 days. It's protecting you no matter when you might be exposed to COVID-19. It also keeps you from spreading. If you wait until get infected within those 3 days of exhibiting symptoms, you might pass along the virus to somebody else. Vaccines prevent, and this would be a way of you're stepping in after the illness has already started and keeping it from getting worse. If you do everything right and you notice your symptoms, you get tested, you start taking the pills within 3 to 5 days of that infection, then they will have that 89% effectiveness. Vaccine, it's just 90-something% effective all the time.
One of the patterns that we've seen over the last several months as the vaccines have become politicized, and before that, obviously, I think we saw this when masks were politicized as well. For a certain segment of the country, pronouncements from official sources, whether it's from the White House, whether it's from the CDC or FDA and so forth, a certain segment of the populace just almost rejects those and looks at alternatives, whether it's the ivermectin or some of these other supposed wonder drugs. I mean, we saw the same thing with the football player Aaron Rodgers saying, he did his own research. Even with an alternative like the COVID pills out there, can we anticipate public skepticism or just rejection for whatever it is, 35-40% of the country that is just wary about official medical pronouncements?
I mean, I think that's a soft thing that's hard to measure, but I also suspect that a lot of our impression of how much resistance there is to vaccines is sensationalized and exaggerated. Pfizer has done polls that when these vaccine mandates go into place in people's workplaces, only about 5% of people are so resistant to vaccination that they will quit their job or be laid off from their job because they just really don't want to get a vaccine. When it comes down to, when people are really faced with that choice, it doesn't, the situation isn't as bad as it seems with people out in the street carrying signs and making a lot of noise about being against the vaccines. Yes, a lot of people are opposed to vaccines, and some of them have understandable reasons. But I think that vaccine mandates can bring the number of people vaccinated up to their highest possible level. And that's what you need to do in a public health emergency like this.
Right. I think we've seen in New York, where we're headquartered, that there've been some like large protests from public workers when the city announced that there was going to be a vaccine mandate, and some of the strongest resistance came from the uniformed forces, firefighters, police, and so forth. But then when the mandate deadline hit, we did not get anywhere near the kind of numbers that people were saying we're going to stick out or stay out. I think there have been some early reports that there are some issues with sanitation workers and so forth. But generally speaking, the vast majority of people came into work. There's still some negotiations going on involving, whether certain exemptions will be allowed here and there. But generally speaking, putting the mandate out there ended up getting the response that the city needed, and I think we've seen that in some other places out west as well.
The vaccine mandates work, and that's why they're so important to use. The truth is, less than 60% of people in the United States are fully vaccinated. A slightly higher number have had at least one dose of a vaccine. And of course, there are a lot of people, children under the age of 5 and so on, who aren't able to get vaccinated. But 60% is I think I lost my internet connection.
I think you said when I lost you there from Mary, you said that 60% was too low a number. Is that where you were?
Yes, the reason we keep having surges of COVID-19 in various states right now, Michigan and Minnesota are suffering, Colorado still is because not enough people are vaccinated to keep the virus from circulating in the population.
Exactly. So we've looked at the vaccine side of things. We've looked at the COVID pill, and as you said, 60% of adult vaccines is nowhere near enough. Where are we on the booster side? Is there a sense of, do we know how many people need boosters? Are we going to get to a point where a booster mandate is going to be necessary? Where do things sit there?
It looks as if the FDA is going to approve boosters for all adults possibly tomorrow, and then by Friday the CDC could come in with that recommendation. It seems good because the 2-shot regimen of the vaccine seems to still be working largely, but there's concerning signs. There's been data from Israel suggesting that protection wears off after 6 months. And in Germany, John Authers had a chart in his column this morning showing that in Germany, where they're having a surge of COVID-19, 30% of the people in hospital with COVID-19 are vaccinated. So there's just signs that boosters are going to be needed. As time goes by, they'll be needed more because it is a time-based thing, the wearing off of the effectiveness of the vaccine. So we're not there yet, but if it gets to a point where it looks as if people aren't protected without boosters, then that would make sense to include them in vaccine mandates in workplaces and restaurants and wherever they exist.
You've been covering health issues for a long time, so that's why you're kind of our in-house point person on all things pandemic. Do you think that the public messaging could have been better and could be better going forward? Because I think, forget about, obviously there's some adamant anti-vaxxers out there. We understand those. But for the average member of the public, is there sometimes conflicting messages because they'd say, well, there's breakthrough cases, and but I took the vaccine, and am I really is it still possible for me to transmit it to somebody else? It seems to me that there's a lot of things that are going on that the public just often seems to be confused about, and it seems like the suggestions from the public authorities seem to adjust every week or so.
There's so much about this whole pandemic that just isn't black and white. These surges that are occurring in various states, some of them have high vaccination rates. The surges that are occurring in Europe right now are, people try to explain them by saying, well, maybe they let down their guard on mask wearing, or maybe the vaccinate. I mean, there's some aspect of this that's mysterious. And so people might be confused because this whole pandemic is pretty confusing. It's not clear whether how readily a vaccinated person transmits the virus. Probably much less than an unvaccinated person, but some apparently. And so there are a lot of, it isn't as if science has perfect understanding of the pandemic, but officials in government organizations are just sort of fuzzing it up. It's complicated. And now with this new, what's expected tomorrow from the FDA to say booster shots should be for everyone, that's a lot more simple. But when they came up with the earlier guidance, it wasn't as clear that booster shots should be for everyone or were needed for everyone. So, yeah, it's complicated.
Okay.
And therefore confusing.
Exactly. Well, Mary, appreciate you coming on and trying to add some clarity with it. So if we could narrow this down as quote clearly as possible, get vaccinated if you haven't already. If it's been more than 6 months since your last vaccination, get a booster shot. And if you do end up, if you're not vaccinated, and even if you are vaccinated and you come down with COVID, it looks like there is antiviral pills out there. So broadly speaking,
they're not approved yet.
Yeah, exactly. Hopefully the FDA will approve those, within the next few weeks. So I guess did I pass that test, Mary?
It sounds good to me.
All right, thanks.
Very simple and not confusing.
Fingers crossed. Mary Duenwald, thank you once again for coming on board Bloomberg Opinion Editorial Board